again, another great day here at the Texas Association of ACOs. You never know who you're going to run into, what innovative solutions you're going to find. And one that really stood out to me is actually an organization that we saw on day one from our Texas Association of ACOs Bull Tank. It was one of the four that made a pitch from an early startup organization in terms of how they were going to create better alignment and VBC models. I'm joined today by Dean Rottinghaus, who is from QurHealth. We're going to dive a little bit into what QurHealth is, who they serve, and don't want to spoil the surprise. We're going to talk a little bit about some AI technology and their partner, Sheela. So, Dean, thanks so much for joining me. You guys did a phenomenal job in the Bull Tank. I was really impressed with some of the solutions that you guys are providing. I want to dive into it. I want to talk a little bit about the pilot that you guys have worked on, some of the organizations that you're supporting. But before we get into some of the technical components, let's talk a little bit about where you guys started. So let's not only talk about QurHealth, let's back it up and talk about Ventech and what they do and what data you're able to pull from a quality perspective within CMS and kind of leads into where we are today.
Absolutely. So great story. Our founder, CEO, Ravi Kunduru, started a company about 22 years ago called Ventech Solutions. Ventech Solutions for the last 13, 14 years, has been exclusively the largest data aggregator for CMS quality measures. So any provider here, any post-acute facility, any dialysis center that sent quality measures, quality data to CMS went through our technology. So he started that company, Ventech Solutions, ran it, and about 6-7 years ago, prior to COVID, CMS actually came to him wanting a solution in the post-discharge space, because that's where patients, they lose track of patients. And so having some kind of technology to keep patients engaged or stay engaged with patients. And so he came up with Sheela and QurHealth.
Outstanding. Well, let's talk a little bit about QurHealth and then tell the audience who Sheela is.
So QurHealth, first of all, is an Agentic AI platform, technology platform, healthcare specific. This is what really sets us apart from our competition. We are healthcare centric. We don't go outside of our lane. We're not, if you call Papa John's, we're not that voice on the other end, that agentic voice on the other end. We are specifically for healthcare. She's the one who talks to, whether it be our patients, our providers, payers, whoever it is. That is Sheela. Sheela, quick story behind that. Everybody wants to know, where'd you come up with the name Sheela? It's spelled a little bit differently, Sheela. Sheela is actually Ravi's wife. So he named the agentic agent, the agent, after his wife.
Wow.
So it's a good story.
That is a really good story. So what's a day in the life for Sheela? So some of the tasks that she handles kind of from the front end all the way through to the back end.
Yeah, so I'm going to go back a few years, because we really started prior to COVID, like I mentioned, in patient engagement. And this technology, AI technology, this voice technology that I'm talking about, it changes almost daily, weekly for sure. So we started out in that patient engagement space, really in the RPM, CCM space. And if you think about it, especially 4, 5, 6 years ago, you're really engaging with 70 and 80-year-old people. And the technology wasn't great then. It's evolved so much now. But so the adoption, better than we thought it would be, but that space is very, very hard to get into. The home healthcare space, SNF space, stuff like that, just because the margins are so small there. So when I came on board, I'm the chief clinical officer. When I came on board about 3 years ago, we really pivoted into more of the healthcare systems. So hospitals, especially smaller hospitals, payers, and so on. So we pivoted into that space, really a little bit away from the patient engagement space. And then the technology has evolved. And we really had our true turning point in November of last year, where we started to become, instead of an app-based technology, we went to voice over IP. We went to actually being able to make calls to patients calling in, or providers calling in, Sheela making calls, receiving calls. That's where we really pivoted in November, December. And now it's basically exploded. We've just had so much growth here in the last few months.
Yeah, well, and that's been great too. So again, I got to kind of see front and center for the story as we went through the Bull Tank, but would love to hear a little bit about some of the problems and impacts as that shift has occurred and what you guys have been able to solve. Maybe talk a little bit about the pilot program as well.
So we've got a few programs going on. The big one, CHOP, Children's Hospital of Philadelphia, University of Pennsylvania, is you want to call it our landmark client. And we are integrating with Epic on the children's pediatric oncology protocols, chemotherapy protocols. So Sheela will actually interact with the patients and also their caregivers, parents, or whatever, and also with the providers. In the pediatric oncology space, those chemotherapy protocols are literally handwritten from one provider to the next provider. So we are automating that whole process with the integration with Epic, and then able to communicate from one provider to the next, but also having Sheela being able to communicate with the patient. And, if they're too small to communicate with, we're communicating with the caregiver or the parent. So that's our big, landmark client right now. But we have a couple of other pilots going on, which are a big one, which we went live about a month ago with a Medicare Advantage plan out in Maryland, where Sheela, the Medicare Advantage plan called QurHealth, they're our client. Sheela takes inbound calls. And right now we're doing inbound calls around eligibility of the members. So a provider's office will call in, Sheela answers the phone, asks for the NPI number and asks for the member ID number, and she is able to respond immediately whether the patient has insurance, valid insurance, and so on. That's going to catapult into benefits, and whether we can do, whether a patient needs to be prior auth for a procedure and so on. And from there, we're going into claims, whether a claim has been paid and so on. That's going to happen within the next 30 to 60 days, all of those things. We have our immediate returns from that have been unbelievable. The CEO he can't believe how well it's going. So that's one that has gone live here just recently. We got another one in South Florida called Ventech Solutions, and that's basically it's a large MSO they have about 3 to 4 million lives, but we're doing that tier 1 or level 1 in a call center where we're doing claims data on those members, those patients. And so that's a huge one that's going to go live here probably in the next couple of weeks. Probably one of the ones I'm really excited about is in Cincinnati, a large orthopedic group, 50 provider orthopedic group they've contracted with us. We beat out some of, the competition that we would think about in that call center space. And we are actually integrating with Epic there. They're a large Epic client. They use the Epic instance for St. Elizabeth in northern Kentucky. And we are fielding all inbound calls and scheduling patients. So if a patient calls in and says, I've got a shoulder problem, Sheela will immediately know which provider of those 50 only works on shoulders. And maybe it is someone under, it's a 70-year-old. And some docs don't want to work on anybody under, over 70 years old or over 60 years old. So Sheela will automatically know all those protocols, schedule the patient, interact with the patient, collect vital information about the patient, and then send them information to confirm all their appointments. So that's a huge opportunity, huge use case for us, and we're very excited about that
Yeah,
one.
well, I think it's interesting too because it's all these things. I always talk about kind of the point-to-point solution. People look at both of the NCAS, but in terms of value-based care, there's so much opportunity along the continuum, and you guys are being able to kind of interject into those workflows and create opportunity for best practices along those continuum. And so one of the other things that was really interesting to me, and maybe you want to talk a little bit about it, is from a protocol perspective, but more on the discharge. So, hey, here's all the discharge summary. Here's all the instructions. Patient calls in. I'm confused. I don't understand this. And you guys were able to kind of walk them through all the next steps.
That's exactly right. That's why it's so exciting about value-based care, ACO model, and so on. But on that post-discharge, we would have all of that information for that patient, their care plan, everything, the medications that they're supposed to be taking. And Sheela can call that patient, and the patient can actually ask Sheela questions. I don't quite understand what the doctor said. I don't, what medications am I supposed to take in the morning? Which ones am I supposed to take in the afternoon? And Sheela will have all that information because we're integrated with their EMR and also have that care plan right there. And she can answer all of those questions. So if you think about that in a value-based care setting, to be able to keep that patient from a readmission is so important. And that's where that shared savings comes in. And that's where the quality measures, the HEDIS measures and so on are so important.
Well, I think you're closing the gap too, because we talk a lot about, handoffs, right? And I don't think they necessarily should be handoffs. Like, these transitions in care are really opportunities for vulnerability. And what you've done is not only been able to meet the patient where they are and walk them through the instructions that maybe aren't clear, but then closing the gap and getting them scheduled or making sure there's a follow through on that transitional care visit, and then bringing all of that with them into the practice.
That's right.
Yeah.
Just keeping the patient engaged, being able to reach out to the patient proactively and giving them information about their care and answer questions that they might have. It does close that gap. That's really where, if it goes back to what I said a few minutes ago about CMS really came to us and said, there is that gap, and it's been a gap for a long time. And we are slowly just really taking care of that gap and helping patients.
Yeah. And I think one of the other things too, if I remember, you guys even have the ability to do kind of, patient reactivation, reach out to folks that have missed annual well visits, bring them back in. And so you're just keeping that connection with that patient and with that practice, which is huge in value-based care and attribution.
Yeah. Keeping it within the practice. You don't, and I practiced for a long time in Cincinnati. So knowing you want to keep your patients within your practice and being able to reach out to them proactively and find out how they're doing and get feedback from the patients, it keeps them within the practice and also keeps them well.
What other, things have you guys thought of where other opportunities are coming down the pike? Because it seems like you guys are finding problems to solve and you're able to deploy this at scale to really close the gap and close the distance. Are there other things on the horizon or things that you thought of that would be innovative?
So large healthcare systems were really the opportunity with OrthoCincy in Cincinnati. That is like I said, a 50 provider orthopedic group, part of a larger Epic instance with St. Elizabeth's in Northern Kentucky. So we have already been engaged with certain parts of St. Elizabeth's, which is a huge healthcare system, taking this to scale at a large healthcare system. They have 5 or 6 hospitals in North Kentucky, and also in Indiana, and being able to really just affect change within large healthcare systems.
I love it.
So that's a big opportunity. I mean, that's really, and it's the whole enterprise solution. Another area that is really innovative for us, and we are making inroads. I actually got a call I owned 2 diabetes clinics when I was practicing. I owned 2 diabetes clinics in Georgia, in 2 of the poorest counties in Georgia. So you can imagine rural health, and that's a huge problem. We talked about it here with team and with some of the things that are going on in rural health, some of the initiatives with CMS right now. I had a CEO call me a few weeks ago from Bainbridge, Georgia, and he is the CEO of a 187-bed hospital system, Memorial Hospital and Manor, and he wants us to come in because they can't get staff. They can't just retain staff in the rural settings. So getting into rural settings and bringing innovation into the rural healthcare is really one of the areas that we really want to explore.
Well, I just wrapped up a national executive roundtable on rural health transformation, and that is one of the problems that we're all trying to solve, not only from a broadband perspective, but how do we create better reach? How do we create better workforce stability, optimization? How do we use these tools to really keep the engagement and do all the things that we can do to keep care local? So, man, this has been great. I'm really excited about what you guys are working on. I think for anybody out there, if you're not familiar, what I love about value-based care is you see so much innovation, so much opportunity, so many people that are all contributing to the same problem, which is how do we move healthcare forward together? And Dean, this has been an absolute phenomenal conversation, so I appreciate the time.
I appreciate it.
Pinnacle is your partner in the business of healthcare, nationally recognized for helping clients manage risk, improve performance, and drive innovation. For more information, visit our website, askphc.com. For more information on our guest or to learn more, please visit their website.